Yes, yes, I'm ready.
Okay.
Can I start?
Mhm.
Sure.
Okay. Okay. Good evening. My name is Imran, and I'm going to present about the osteoarthritis and the promising role of mesenchymal stem cell derived extracellular vesicles in the treatment of osteoarthritis. The presentation revolves around the central idea of a review paper, which I am currently writing. So I will be briefly going over the introduction of osteoarthritis and its pathophysiology and current treatment regimens available, and then I will discuss about the extracellular vesicles and mesenchymal stem cells, and then the uh, EVs from mesenchymal stem cells and why we should prefer EVs over just mesenchymal stem cells for treating the osteoarthritis. So I will provide the introduction of osteoarthritis. Osteoarthritis is a chronic progressive degenerative joint disease, and it is currently affecting around 600 million people worldwide, and it is also a leading cause of disability and premature work loss. According to some estimates, the people affected by osteoarthritis, the number can reach to around 1 billion worldwide by 2050, which is itself is a very concerning situation for the healthcare. Usually, osteoarthritis can affect any joint in the body, but it is the main affecting areas are the weight-bearing joints, such as knee joint and hip joint, and also hand and feet. Apart from those joints, it can also occur in the neck or elbow or base of thumb or toes. And if we look at the risk factors of the osteoarthritis, we can divide them into two types. One is modifiable risk factors, and another one is non-modifiable risk factors. If we go over modifiable risk factors, we can see obesity and joint injury or the muscle weakness or imbalance. Why obesity can lead to osteoarthritis is because when a person is obese, there is constant immense pressure on the joint, and then it can and the constant pressure can then lead to osteoarthritis. And if you look at the non-modifiable risk factors, the major ones are age, gender, and genetics. Uh, Elderly people are more prone to develop the osteoarthritis as compared to the young people. And when it comes to gender, elderly women are more susceptible to osteoarthritis as compared to elderly men. And when we discuss the genetics, if the parents have the osteoarthritis, there is a high probability that the offspring will also develop osteoarthritis. Although it is a very widely occurring disease and also very widely studied, but the exact pathophysiology of osteoarthritis is still unknown. Previously, it was thought as like osteoarthritis is a wear and tear disease, which means that more the use of any joint, the more it will be damaged and can lead to osteoarthritis. But according to current studies and development, it is found that it also involves the degradation of the cartilage and the bone remodeling in the joint area. If we look at a healthy joint on the left side, first we can see a very smooth and healthy articular cartilage, which provides the cushion for the bone on bone movement. And then we see a healthy synovial linings, which secretes the synovial fluid and provide the lubrication to the joint. And then we see a normal subchondral bone. On the contrary, when we look at the osteoarthritic joint, the main damage is to the articular cartilage, where it is almost destroyed, or it is in the pieces. And then we see an inflamed synovial cavity, or also inflamed synovial cavity is also called synovitis. And we can see some kind of osteophytes. It is also called bone spurs. It is actually trying to compensate the loss of articular cartilage, but actually it is adding more to the pain, as there is no cushion between the bones. When we move the affected joint, it will cause the friction between the bones and cause more pain and more inflammation. So there are many factors which can lead to the above said condition, but the major ones are cartilage degradation or inflammation or mechanical factors. If we look at the cartilage degradation, it is caused by the dysfunction of the chondrocytes. Chondrocytes are responsible for maintaining the integrity of the cartilage by secreting proteoglycans and collagen. When a chondrocyte is dysfunctioning, or it can secrete the proteins which cause the destruction of the cartilage, such as matrix metalloproteinase. And if you look at the mechanical factors, as we discussed earlier, the obesity or the abnormal joint loading can cause the joint damage and lead to the accelerated tear of the joint and cause the osteoarthritis. The inflammation in the synovial membrane can result in the in the destruction of cartilage by damaging the chondrocytes. And once the cartilage debris accumulates in the joint cavity, it can also enhance the pain and the inflammation in the joint cavity, resulting in the worsening of the osteoarthritis. If we look at the current treatment strategies, unfortunately, there is no any disease eradicating therapy. That means we don't have any kind of medication which can completely stop or reverse osteoarthritis. So what we do to ease the pain of the patient, we use our symptomatic treatments. Now we try to reduce the inflammation and the pain of the patient. If we divide treatments into two types, we can call them as surgical or non-surgical treatments. In the non-surgical treatments, we use over the counter non-steroidal anti-inflammatory drugs or acetaminophen, which are quite useful for moderate pain management or inflammation, but not very effective. Sometimes the patients are also subject to the physical or occupational therapy, which can help them increase the flexibility and improve the and avoid the much stress on the affected joint. If the joint damage is too advanced, and the pain is very unbearable, the only option is to replace the joint with a prosthetic, and it is done in the surgical way of treatment, in which we replace the joint to restore the mobility and relieve some pain for the patient. So the question arises, how can we contribute to the treatment of osteoarthritis? The most useful method is using use of the regenerative therapy. Like we try to regenerate the cartilage and inhibit the inflammation in the joint region to avoid the worsening or the development of osteoarthritis. That we can do with mesenchymal stem cells, and more effectively from the extracellular vesicles collected from mesenchymal cells. So I will explain some about extracellular vesicles. They are membrane-bound particles, and they are released by almost all kinds of cells. And extracellular vesicles carry some kind of cargo, which includes lipids, proteins, microRNAs, and some other non-coding RNAs. If we divide EVs on the basis of their size, we have three types: apoptotic bodies, microvesicles, and exosomes. Exosomes are most widely used and studied in this research domain. So how can we use EVs for the treatment? We can use them as for diagnostic or therapeutic application. If we look at diagnostic application, we can use EVs as liquid biopsies or for biomarker discovery. Liquid biopsies are like we collect the extracellular vesicles from the fluid in the patient, like from blood or urine, and then we look for specific markers which can tell us like what kind of disease or what kind of cancer or what stage of cancer the patient has. And in domain of therapeutic application, we can use EVs as a carrier of our drug of interest, or we can use them as anti-inflammatory particles as well. And in terms of osteoarthritis, we can use EVs derived from stem cells for tissue repair. And one of the most famous stem cell used in the regenerative therapy, specifically for osteoarthritis, is mesenchymal stem cell. So the mesenchymal stem cells are multipotent stem cells. They have the ability to differentiate into multiple kinds of cells like osteocytes, chondrocytes, myocytes, and adipocytes, etc. And the abundance of MSCs is also a plus factor for using them in treating osteoarthritis, as they can be easily collected from bone, adipose tissue, umbilical cord, placenta, muscle, and amniotic fluids. Mesenchymal stem cells have proven themselves as a useful in maintaining the tissue homeostasis. The main important thing about mesenchymal stem cells is their mesenchymal secretome, which consists of growth factors, anti-inflammatory cytokines, and bioactive molecules. And the mesenchymal stem cells release their secretome mostly in extracellular vesicles, which are then responsible for stimulating the tissue repair, reducing inflammation, preventing cell death, and also promote angiogenesis. Mesenchymal stem cells can be used in two different domains. One, MSC itself can be administered to the patient, and another one is like we use extracellular vesicles from the MSCs. So one is called cell-based therapy, and one is cell-free therapy. So the question is, if we can use mesenchymal stem cells as a cell-based therapy, then why we use the EVs from mesenchymal stem cells? Although MSCs have been very useful when they are used as cell-based therapies, but there is always a risk of tumorigenicity, since we know it is a stem cell and it is a multipotent stem cell. So it has the potential to continue its division and then result in the tumor when we administer it into the patient. On the other hand, if we use extracellular vesicles from mesenchymal stem cells, which mostly retain the properties of their parent cell, and they carry useful proteins, lipids, and microRNAs, which can induce the tissue repair, and also result in the differentiation into also promote the growth of chondrocytes in the joint cavity. And also EVs are very less immunogenic when compared to the mesenchymal stem cells. And the size of EVs has more age when compared to the mesenchymal stem cell itself, because EVs are smaller in size, though they can penetrate the cartilage extracellular matrix, and and then be more beneficial than the mesenchymal stem cell itself. I have compiled few preclinical evidences of use of MSC-AVs in osteoarthritis, where the extracellular vesicles collected from bone marrow-derived mesenchymal stem cells enhanced proliferation and migration of tenocytes, and also reduced inflammation and maintain extracellular matrix homeostasis. Also, the extracellular vesicles from adipose-derived mesenchymal stem cells resulted in the reduction of inflammatory effects by interleukin-6 secretion, and also restore the extracellular matrix. And they also induced osteogenic differentiation by increasing expression of osteogenic markers. That was a brief about my review paper.
Mm.
Imran, I have one question.
Yes.
Which one is you says about osteoarthritis?
Yeah.
Uh, what is the factor for osteoarthritis? Is it just from the immune cell itself, or is it from due to osteoporosis?
Actually, the exact mechanism is still unknown, but it is estimated that the more pressure is on any bone or any joint, it can result in the degradation of the extracellular matrix of that bone or that joint that can lead to osteoarthritis.
Because I'm thinking for the most of it's like if you think about the autoimmune arthritis, what's the autoimmune arthritis mostly targeting?
There are multiple kinds of arthritis. Actually, I exactly don't know the autoimmune, but I think it can be rheumatoid arthritis, but I'm not sure about that.
So is it targeting the collagen on the joint of the bone or on bone itself?
Actually, it is not affecting the bone. It is just disrupting the extracellular matrix which is around the joints. Like there is one bone followed by another bone on the joint. So there are multiple factors which avoid the friction between the bones, such as articular cartilage or the synovial fluid. But when there is inflammation in the synovial fluid, or there is degradation of chondrocytes or articular cartilage because of some injury or old age, it can result in osteoarthritis.
So for my
Yeah.
understanding, it may not be true. When it comes for the osteoporosis, for the so most of, before I ask doing the who got the which condition which condition of person easily to get the osteoporosis?
Osteoporosis.
Which condition?
Well,
That
in,
certain condition of the people can get the easier osteoporosis. Which one is it?
I think old age people, because they lose their muscle density with time to time.
No,
No.
no.
Can you tell me?
You already mentioned already from your slide, actually. So person who got the women who got the menstruation after they're stopping menstruation.
Yeah.
So then what happened after you got the methylation? That means you're losing the lot of calcium itself that can hold the bone in the calcium. But after you got the methylation, the whole from the whole function and the hormone activity in the ovary was stopped. And then that happens, that you lose the woman can withstand the whole cannot hold the calcium in the bone, and then that causes easily on the osteoporosis, which means they're going to be their hole getting the inside bone is getting
Inside
bigger
the
and
bone.
bigger and yeah bigger. And what happened is if the hole is bigger, then it's easily be fractured, right?
Yes.
That means it's so for my understanding, for women who is getting after methylation, you will have easily to get osteoarthritis either, but
Yes.
not from the collagen in between joints, but from the bone. But if you say it's osteoarthritis, can be easily to happen for other condition can be the targeting collagen, not the bone. That's my understanding. So
Actually, osteoporosis is the disease of the bone, where the bone density is reduced, while
so
osteoarthritis is the disease of joint, where the joint stiffness causes the reduction in the movement and more pain while the movement.
for my understanding, for osteoporosis, the caused by the which is damaging the collagen can be happen to anybody, any ages. But for certain condition like woman who start the menstruation
Yeah,
can be past osteoarthritis not by the collagen itself, but it
yeah, yeah,
can
yeah.
be
It
there
can be
from the
one of the
bone.
reasons. Yeah,
Yes. So
I agree.
that's my understanding from according to your presentation.
Yeah, it is also,
Mhm.
yeah, it is possible that it can lead to the development of osteoarthritis in elderly age women.
Mhm.
Yeah,
Mhm.
But you know,
So
Imran,
yeah,
did you read you already described of the gender factor in the pathogenesis of osteoarthritis.
yes,
It was not completely associated with menopause.
yes,
So actually, osteoporosis and osteoarthritis in women is totally different. Actually, osteoarthritis is not simple. In
yeah,
osteoporosis is relatively simple because definitely estrogen contribute to the 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 bone formation. There is the precipitation of calcium phosphate in the bone. But in osteoarthritis, not
yeah,
associated with the hormonal levels.
yeah,
So far, no one knows. But traditionally, we know the woman, a lot of the women, whatever the old age or whatever the menopause exists or not, definitely woman is more susceptible
more
to
susceptible. Yes,
osteoarthritis. And then for reason, no one knows.
yeah,
You already described about that, right?
yes,
I
yes,
read according to your mention, but
yes,
it is very, very strange. But definitely, all the women is the more susceptible to osteoarthritis, right?
yes, yes,
If the osteoarthritis would be the associated with estrogen level, it easily confirmed by all the by the all the through the all the data and then the studies, right? But
yes.
until
No,
now, no one
no
knows.
connection as you know.
No, no. But you introduced some relationship between the estrogen level and some the the cartilage factor, right? We reviewed the some paper, but the paper that paper is only one
Yeah,
with a very low quality.
so it is not credible.
Right.
Yeah,
We cannot agree with their data, right?
yes,
Understand?
yes,
So osteoporosis and then osteoarthritis totally
yeah,
different
totally different.
in terms of the sex, the gender, the dependent,
Susceptible. Yeah,
right?
yeah.
different. No one knows. 잘 몰라요.
네, 지금
오스테오포로시스하고는 완전히 달라요. 그렇게
그러니까 제가
설명할 수
생각한
있었다면은
네,
오스테오포로시스 그 언급이
네.
그 그 한 반세기 전에 나왔을 거예요. 근데
그러니까
아직까지 결론이 안 나왔어요.
제가 지금 잠깐 생각한 게 뭐냐면 이거 말고 만약에 오스티오포로시스가 그 저기 시비얼하게 일어나서 그 아예 부러지는 상황이 돼버리면 염증도 같이 생길 텐데 뼈가 관절에 깎아내리면서 그럴 경우에 당연히 오스티오아르트라이티스도 같이 일어날 가능성이 있지 않을까요? 그게 심해진 경우를 얘기를 하면.
논문을 안 찾아봐서 제가 드릴 말씀은 없는데요.
알겠습니다. 왜냐하면 제가 그쪽에서 잠깐 그, 그 칼슘 레벨 관련해서 잠깐
근데
공부 좀
그냥
있으니까,
제가 상식적으로 제가 알고 내용을 설명드리자면
네,
그, 그 오스티오포로시스에서 문제가 되는 건 본 셰프트의 저기 그 본 덴시티가 떨어져서 프랙처 이르는 거고요. 그
그렇죠. 당연히 그렇게 있죠.
본의 스트럭처상 그 칼슘 포스페이트가 그래도 가장 늦게까지 남아있는 부위는 그 카틸리지 아래에 있는 서브콘드랄 본, 서브콘드랄
네,
본, right? It is right?
Yeah,
네,
yeah.
네,
그거는
네,
아마
맞아요.
오스티오포로시스가 심한 사람도 거기까지 나갈 것 같지 않은데요.
그러니까 물론 그렇게 포메이션 할 때 그렇게 되긴 하는데 제가 할
예,
때는 그게
왜냐면은 덴시티가 떨어져, 덴시티가 원래 없는 부분이 본 셰프트고 거기가 떨어지면 고기가 문제가 돼서 오스티오포로시스를 오기 때문에 부위가 다른 것 같다는 생각이. 그냥 제가
그러니까
쳐다보는 않았는데.
예, 그러니까 보통 그 오스테오포니에서 오스테오포로시스 들어가기 전에 보통 그 위에 이렇게 있는 그 부분은 이제 그게 줄어든 이제 안에서부터 이제 저기 뭐 튜블라부터 이렇게 쭉쭉쭉 늘어나는 저기 뭐 이제 중심부터 이렇게 늘어나기 시작을 하거든요.
예,
그래서
예, 예.
그래서 이제 밑에 이렇게 하긴 하는데 가끔 이제 그 관절에서 마모되기 쉽다는 걸 제가 본 적이 있어요. 왔다 갔다 하면서. 그러니까 뭐 튼튼하긴 하지만, 튼튼한 편이긴 하지만, 그래서 그거하고 연결시켜서 이제, 그게 좀 더 있지 않을까라는 생각을 하는데, 그거하고 아무 의미가 없다 그러면, 그래서 제가 한번 임란한테 물어본 거였거든요.
예.
음,
예. 저희도 몰라요. 오스티오.
아,
임란, at the end of, at the last slide, you summarize the effect of EV from the MSC in the treatment of
Osteo.
osteoarthritis. Um, for the paper, we need to know we need to describe exactly the mechanism,
Yes.
possible mechanism.
I'm trying to look for it, but there are multiple studies
Mostly,
and
but problem is the paper is mostly actually not the uh, the quality of the paper usually not good.
yeah, I need to
Not
explain in more depth.
right
I'm
in
afraid
depth,
that
right?
yeah,
Exactly in depth, very short,
yeah.
right? That's problem. So you need to summarize all the the from the one paper. You need to taking some clue and then
Try
we
to connect through
right
other.
connect
Yeah.
exactly the
Okay.
all the figure of
Yeah.
role of EV.
Yeah. I'm looking into many papers and everybody is explaining different
Actually,
mechanism.
the rationale of MSC in osteoarthritis is first thing is that possibly MSC introduced into the osteoarthritis
Osteoarthritis joint.
synovial cavity.
Yeah.
MSC differentiate can possibly can
Differentiate into
differentiate
bone
into
or chondrocyte.
not
Yeah.
bone is problem, not
Mm.
not bone,
Chondrocyte
never.
only.
Chondrocyte, functional chondrocyte, right?
Yeah.
But some part of the mesenchymal stem cells, I never uh, I I knew the MSC cannot be differentiated into the chondrocyte in the
In
joint,
in the
never.
joint.
Pathogenic joint, never, never.
Mm.
So we need to know about the mechanism.
Okay.
Mm.
음, 방금 니 오스테오 아트라이티스하고 오스테오포로시스 연관관계하는데, 운동을 하다가 잘못해서 그렇게 생각이 많은 경우네. 그거하고 연결돼서. 그게, 그거하고 상관없이. 그래서 마이크로 프랙처리 일어나가지고 그렇게 됐다고 많이 나오네요. 지금 그런 식으로 논문이 많이 전개되네요. 지금 잠깐 펌프를 찾아보니까. 그러니까
마이크로
그
프랙처.
네, 마이크로 프랙처 관련해서 그러니까 요런 식 지금 아까 한 것처럼 그렇게 뭐 오토 이뮤언이 아니고 그 이미 그 열심히 돌아다녀서 이제 마이크로 프랙처 이렇게 해서 그쪽으로 많이 연구가 되고 있네요. 지금 펌맥 쪽은.
보조, 보조라는 식의 보존,
네, 네.
보조로 연구가 되고 있다는,
그러니까 뭐 어떤 거냐면 운동하다가 그 마모돼 가지고 이제 계속 운동해 가지고 이제 그 콜라겐 단 다음에 이제 거기서 이제 마이크로 프랙처 이렇게 해서 이제 그 뼈가 부서지는 이런 식으로 논문이 많이 나오고 있는 것 같아요. 운동하다가
음,
그런 식의 이제 접근을 해서 같이 접근해서 지금 펌메드 처음에 그렇게 키워드도 있고 그렇게나 많이 나오네요 지금.
음. 그러니까 오스테오포로시스 있는 사람들이 운동 중에 조인트 리전에 마이크로 프랙처가 일어날 가능성이 높고
그렇죠.
그 데브리스가 염증을 유발해가지고
그렇죠.
오스테오아스라이티스를 악화시킨다는 그런 말씀이신.
네, 그게 너무 심하면 마크로 프랙처까지 같이 일어난다고 얘기가.
음,
음. 지금 그러니까 연구는 그런 식으로 진행이 되네요. 지금 잠깐 읽어보니까.
음.
Imran, can I have one more comment for the
Yeah, please.
paper? Yes. But when you write the whole like for introduction and then other thing during the review, for frankly, I understand part of it, every part of it, but I don't know how whole thing join one together. It is hard to understand actually. So can you like if you make the one review on the paper, can you draw one paper for understanding whole diagram? For it is very hard to matching your introduction with the other like mesangial cell or stem cell with the EV. It's hard to understand. And when it comes with the the immune effect, and then with the other cancer, I was totally lost for everything. Actually, it was very hard to understand.
It was.
Yes, because it's like if you make the whole flow chart for whole together with your introduction and then your what you're actually trying to explain, then it's easy to understand. But for me, it's I have to hard to follow. I have to look for the actual paper to like during when you make the presentation. I have to keep looking for your the terminology and everything. So and they're too short, too short.
Because it's a review paper, there are not many diagrams or the research studies to conclude.
Oh
I
well,
tried my
well.
best to touch the every aspect which I am planning to include in my paper.
Mhm. But for my understanding, if there's a no picture, you have to draw like whole the like the flow scheme for the whole paper. That will be the easier to understand. I mean, if this one is
We
well,
are
you about the yeah.
we are still in the process of developing it, so I will definitely keep your suggestion in my mind while I'm developing it.
Okay, okay, okay.
It, actually, it's not questions, just my uh, pre or my thinking about the mesenchymal stem cells EV,
Yes.
because I have some experience effect of EV on the cells in cellular level. When the much very large amount of EVs when the EVs are in large amounts when treated to the cells, in my experience, actually all the effect is inflammation.
Or inflammation.
Right. Even the mesenchymal stem cell EV also induce the inflammation
Inflammation.
and sometimes resulting in cell death. But everybody said that the EV from the mesenchymal stem cell is
Yeah. That's
regenerative,
yeah.
and then induce proliferation of some cell. So still, I did not understand yet why. Maybe the dose is.
Maybe they use the minimal dose or some kind of
I
modification.
I read the paper previously. I I remember we discussed about that. When the what very high amount of EV is treated to the cells, the effect of EV is very similar in
Yeah.
all EV from the all kind of source in all kind of condition. But when the dosage of EVs are reduced, then the unique effect of each
Yeah.
EV is appeared.
Yeah.
Maybe that's problem. But still, I cannot understand about that. Always I'm thinking about that, but I don't know exactly.
네, 솔직히 저한테 이 논문 굉장히 어려운데요, 이 리뷰. 굉장히 어려웠어요, 저는. 사실.
이 논문이요?
네, 그러니까
이거
제가,
논문 아니고 이거
이거
임란 스킬이
그래요?
예,
그,
지금 쓰고 있는 거예요?
굉장히 어려운데요. 제 이해가
처음
아주,
들어보셔서 그래요. 이거 뭐
그,
사실은 임란 리뷰 예전에 썼는데요.
네네네.
GP가 없어가지고 도저히 리뷰로서 가치가 없는 것 같아서 다시 쓰고 있는 거예요.
아, 그래서 지금 제가 좀 따라가기 좀 쉽지가 않아가지고, 내용 가지고 이게 굉장히 뭐랄까, 이게 여기 엮이고 저기 섞이고 하니까 이걸 어떻게 연결시켜야 될지 저도 이런 점은 좀 별로 없는데, 이게 저도 어떻게 연결시켜야 될지 저도 감이
네,
좀 안 잡히네요, 솔직히.
많이 더 써야죠.
음,
많이 자세히 써야죠. 많이 부족하죠.
그래서 이게, 은별 학생 있어요? 은별 학생 없나? 은별 학생
다음 주에는 은별 학생이요? 은별 학생이 발표해요?
아니요. 지금 질문하는, 다음 할 건 예은 학생이 발표를 할 건데, 지금 아까 저랑 실험하다가 집에 돌아가는 과정이라서 아마 지금 답변을 못 할 겁니다. 지금 지하철 안에 있어가지고.
교수님
다음에,
지금
네.
저기 저 36대세요?
아니요, 36대 갔다가 지금 한다고 36대에서 얘기해서 다시 집으로 복귀해서 지금 하고 있어가지고, 제가 실험이 4시쯤 끝나고, 그 다음에 예은 학생이 나머지 실험, 에세이 하고 지금 돌아가는 길이라서 지금 아마, 했는데,
그 댁에서 삼육대학교는 거리는 가까운데 진짜 솔직히
안
말해서
가깝습니다.
아니
50분만입니다.
가까운데 그놈도 그
네.
동네가 제가 살아봐서 안 되고요. 차가 그지 같아. 도로가
네, 맞습니다. 그건
답답해.
맞습니다.
그 완전히 그 길을 생각하면은 아주 삼육대학교에서 교수님 거기 고대 있는데 아까 저기 고대가 아니고 거기 어디야? 그
외대
외대
교수님.
쪽 생각하면은 길이 깝깝합니다. 그 동네.
아니, 오늘도 어떻게 왔냐면 학교에서 지금 몇 시에 왔냐면 있다가 11시 반쯤 출발해가지고 집에 잠깐 들려서 집사람이 태워주는 차 타고 36대 갔다가 다시 돌아온 거라서
음,
좀
고생
교통편이 안 좋습니다.
많으십니다.
그래서, 뭐 실험을 해야 되니까 그래서 하여간 김예은 학생이 다음 주에 17일 날 발표할 거고요.
네,
그리고 아마 보시면은 아마 조금 되는 내용이긴 한데, 그, 아마 좀 재미있을지 않을지 지금 모르겠지만 하여간 나온 결과가 그렇게 나왔으니까 나온 결과대로 발표를 하는 거니까 아마 그 장기 저기 해서 연세대랑 같이 하는 지금 그 연세대 신소대용학과랑 교수님이랑 같이 하는 프로젝트 지금
네,
그거 최종 발표회 하를 하는 자리라서 아마 보고 아마 PT 준비할 겁니다. 아마 잘 설명해야 될 텐데.
음. 잘 설명 안 해도 돼요. 배우는 건데. 음.
그리고 하고 그 7월 달에 제가 그 아마 어떻게 될지 모르겠는데 가서 그 뭐였죠? 그게 잘 되면 줌이 잘 되면 모르겠지만 미국 그 호텔에서 줌이 잘 안 되는 경우가 있어서 일단은 잘 되면 괜찮고 안 되면 호스트 기능을 저희 최영진 선생님한테 넘겨드리고 저는 그럴 수 있으니까 그때 제가 언제지요? 제가 그 새벽 2시에 해야 되더라고요. 보니까 그 시간
아유,
2시간이.
저기 학교에 갈 때 하지 마세요. 7월 달이고 그 휴가철이라 가지고 저기 쉬어야죠.
아유,
휴가.
저희 네, 7월, 지금 7월 15일이고, 마지막 날에서 널널하겠다. 10회
네.
마지막 날이라서요.
원래 방학
저는
때는
널널, 응,
쉬시죠.
응.
쉬면 되죠. 2시에
어,
무슨 미국 가서 미팅을 하신다고.
저 맨날 그렇게 해서 일단은 그렇게 해서 만약에 안 되면 제가 접속이 제대로 안 되면 호스트 기능 최우
예,
선생님한테 넘겨요. 예, 예.
예,
그게 작년에 했긴 했는데, 작년 10월 달에 제가 미팅을 했는데, 그때 호텔 로비 앉아서 했다가 시끄럽게 한다고 요거 넘어가지고.
예.
그래서 하면 호스팅 기능 나오는데 만약에 방에서 할 수 있으면 지금 하는데 지금 문제가 지금 저 방을 지금 정윤선 선생님과 같이 쓰게 생겨가지고 그 안에서 발표하기가 좀 조금 좀 그렇긴 해서 알겠습니다. 그럼 다음 주 다다음 주 30일까지 저희 삼덕대 학생 3명이서 연달아서 발표하는 걸로 그렇게 하겠습니다.
네, 알겠습니다. 그러세요. 예,
그리고 아마 제 쪽에 아마 학생회장 하나 더 아마 들어올 겁니다. 저희 쪽에서. 그래서 4명, 총 1명 더해서 아마 그 학생까지 하면 더 들어올 테니까. 네.
네, 그렇게 하십시오.
네,
예,
알겠습니다. 네, 네,
예,
수고하셨습니다.
수고하셨습니다.
네네네.
일단,
네.
Thank you.
굿잡.
Thank you.
Imran, nice work. Nice work.
Thank you. Thank you, Prof.
네.